We are here today to take some time to talk about healthcare transition skill building in schools and look at some tools that are out there for students and families and professionals. So my name is Tammy Burns, and I am a project manager at PTC, and I'll tell you a little more about PTC in just a moment. And I'm going to let our other two presenters introduce themselves this morning or afternoon, wherever we might be.
Thanks, Tammy. My name is Samitha Alongo, and I'm with GOT Transition, and I'm a Health Research and Policy Associate.
And I'm Peggy McManus, and I co-direct GOT Transition, which is the National Resource Center funded by the Maternal and Child Health Bureau. And I'm delighted to be here with this team and all of you. Thank you.
Wonderful. Just a couple of housekeeping things before we get started. Again, you can see the chat box and feel free to utilize that. We will be having a Q&A time at the end, some participation pieces where you can use the chat box to do that, or you can raise your hand and we can unmute you or let you turn your video on to ask questions. That would be great. So utilize that chat box as you need. Again, continue to introduce yourself, because I think that's a great way for us to see each other and what we're doing, how we all interact here. I'm seeing all sorts of organizations and ways that you guys are involved in the planning of students with disabilities or students with exceptional needs, from all sort VR, as well as school systems, as well as community support systems being represented here today. So that's wonderful. We will be at the sometime today, before the day is over, I will be emailing everyone who has attended a PDF copy of this PowerPoint. There are some links, some URL links within the PowerPoint. So we want to make sure you have that so that you can access those things after this presentation. So we will be emailing that to you, and that way you'll be able to access all of the links as well as have this information. So we are going to go ahead and get started. One of the things I am going to do, because we do have almost 200 people signed on now, and I know for some of you that could cause a bandwidth issue. So I am going to, at this moment, turn off my video until we get to Q&A, and then I'll turn it back on just to let you know, for those of you who might be having bandwidth issues, to try to prevent that a little bit. But we'll be right here and be presenting this information to you. All right, so let's get started. Let's see, let's get this moving forward. Here we go. So if we want to start just giving some funding disclosures. This work today is funded by RAISE. RAISE is a SPAN project providing technical assistance to support youth and young adults with disabilities and their families during that transition to adulthood. Also, GOT Transition, as you just heard a little bit about, is a program of the National Alliance to Advance Adolescent Health and is funded by the Health Resources and Services Administration of the U.S. Department of Health and Human Services. The contents of this presentation, whether it's from GOT Transition or PTC, do not represent the official views or an endorsement by the organizations that you see listed there. PTC, we're known as PTC. We are the Parent Educational Advocacy Training Center. We serve as Virginia's PTI, Parent Training Information Center, and the RSA Parent Center for Virginia, North Carolina, South Carolina, Georgia, Tennessee, and Florida. You see our funding grants there. And again, just a funding disclosure and just a general disclosure, this presentation does not necessarily represent the official views or an endorsement by those listed. All right, so who is PTC? Just to tell you a little bit about PTC as we get started. PTC is a federally funded parent center for the state of Virginia. For those of you in the United States, each state has at least one federally funded parent center. PTC has served as Virginia's since those began with IDEA. We also serve as the federally funded RSA Parent Center for Virginia, which represents Virginia, North Carolina, South Carolina, Tennessee, Georgia, and Florida. That region of states is who we work with. Our mission is to build positive futures for children and young adults by working collaboratively with families, schools, and communities in order to improve opportunities for excellence in education and success in school and community life. A special focus on children with disabilities. And how we do that is we provide outreach to families in free and confidential one-on-one consultations We do in-person and virtual workshops, a lot of virtual right now, as you can imagine. And then we provide resources that we strive to make extremely understandable. We use a lot of plain language to really make sure that what we're doing is understandable by the people who are reading that. You also see there some of our social media and our website link as well.
So we are Got Transition, and like Peggy mentioned, we are the federally funded National Resource Center on Healthcare Transition. And our aim is to improve the transition from pediatric to adult healthcare through the use of evidence-driven strategies for clinicians and other healthcare professionals, public health programs, payers and health plans, youth and young adults, and parents and caregivers. And you can visit us anytime on social media, on Facebook, Twitter, and our website is linked below, gottransition.org. And all the resources we mentioned today are available on our website. Next slide, please. So here's an overview of what today's webinar will cover. First, we're going to learn about the importance of healthcare transition planning in special education. We're going to identify some tools and resources for students and families for healthcare transition planning and other life skills. And finally, we'll discuss additional ways to prepare students and families for healthcare transition. Next slide. So we like to focus on the importance of healthcare transition planning, and it's something that's often overlooked. There hasn't been a lot of attention with helping students learn about their health needs, their medicines, how best to manage their own health, how to use healthcare, and often how to plan for that transfer to adult healthcare. We like to always show this figure where we have a big focus on post-secondary education, as well as employment, independent living, but that health piece is often missing. And we also like to make sure that everyone here understands that without health, a lot of these other aspects of life are hard to succeed in. Without health, you may not be able to work and be employed efficiently. You may not be able to pursue post-secondary education. And without being able to manage your own health, it may be difficult to live independently. So they all work together, and that health piece, however little attention has been focused on it, is very important. And we want to stress that as a theme throughout this webinar today. And I'll turn it over to you, Tammy.
All right, great. So what you see here is this new tool that we have worked together, PTSI and Got Transition have worked together to develop called a Healthcare Transition Skills Checklist. We will be, I know a couple of questions have come in, people have signed on, we will be sending you a copy of this PowerPoint, and it will include a link to where you can access this online and download this. But this was developed to really have a, you can see it here on the screen, to give people an opportunity to look at these specific healthcare care skills and to document when the student, the youth, is something they already can do, they need more practice doing. This is something they plan to start working on, something that they might need ongoing support and what that might look like, as well as just something that's not, sometimes there might be something that's not in that person's life at all. It is going to, you might use NA. So let me tell you a little bit more about this. I know for some of you, this might be, you're saying it's hard to see. Again, we're going to send you a link where you can actually, we're going to dig into this a little more so you'll have an opportunity to see it a little bit deeper. So let me talk about that new tool for a minute and how it was developed. So as I said, PTSI and Got Transition, we work together. We're both working on various things around transition to adulthood. So we would get together and meet regularly and we work to create this healthcare checklist based on a format of something that PTSI had already created, which is our life skills checklist. And again, that is a link that you guys will be able to see. The checklist skills were adapted from Got Transition has this wonderful transition readiness assessment. And so we started looking at that, and they started looking through that to see if that was something that we could use. And we used the ideas and work within that they'd already done to develop this specific checklist. This checklist was designed to be easy to read. It was reviewed for plain language and is at an appropriate reading level for transition age students. We wanted to make sure that, again, that it was understandable by the people that we thought might be using that. And again, when you get this PowerPoint, you'll be able to click that link you see there at the bottom, which is the actual link for the checklist itself that helps the healthcare skills checklist, so that you can have access to that. This is something that, excuse me. Oh, I don't know why it skipped their slide. There's a slide that it skipped just now. So let's go here. Examples, sorry about that, of how to use the new healthcare checklist. As you can see, you know, and as we just talked about earlier, it is important that healthcare and that transition be looked at when planning for that transition to adulthood. And so that can be used at the same time that any planning is being done for a youth or young adult in that transition phase. So it can be used in just regular transition planning when you're meeting with students and saying, hey, let's look at this. How are you doing with these skills? Are you able to read the labels on your medication? Do you know who your doctor is? Because those are these skills that have been identified as important. So in those transition planning meetings, and then to plan goals around that. It can be used for training of special education teachers to say, here are some skills that you might want to consider as you are working with your students to see where they are on this. So you can use it as an assessment, but also what might need to be worked on. And the same thing, in the same vein for family education, it can be used with families to say, okay, here's a same as our life skills checklist. You know, here's a baseline for where your child is. And here's some things that you might go, well, this is a really important piece to their life. So we're going to begin working on that. And as well as peer mentoring training for peers, peer-to-peer looking at and how do we, let me show you how a skill that I have found important. And this is how I work toward that skill. And this might work for you type things. So it really could be used in a lot of in any planning for that transition from, you know, being a child, a student to an adult, and what skills might be needed there. And it can be used ongoing. It doesn't just have to be within that time frame of leaving high school. This is something that can be used throughout a lifespan. So some other PT tools that I want to mention that kind of co-partner with this a little bit. Again, I mentioned that life skills checklist. That is a longer document that really looks at those independent living skills, can be used with students very young to begin to plan and think about what things might be important in their lives. We also have a student profile that you'll be able to access, which is something that can be used in planning for IEP meetings and various other kinds of meetings that just give a really clear picture of who a student is and help to think about plans for the future. And then something we've recently developed and working on and very excited about is we have developed a sexual health and wellness toolkit for parents of students with disabilities. And that is accessible on our website. And we're doing trainings around that as well that are open to parents and students, and we'll soon have a professional development one as well. So I encourage you to check out those links on our website, use those as appropriate. And again, this healthcare transition checklist falls right in line with our life skills checklist and is actually something on the next print that will be included within it. And right now we're using it as an insert when we're using it with families. So did want you to have access to that as well.
All right, so now I'm going to go over some GOT transition tools that can also be used in this setting. So our team worked with DC's community of practice on secondary transition, as well as local special educators, city officials, and families to create 2 IEP tools for not only students and the families, but also for special educators. And I know some of you on today's webinar have already seen these tools. They've been on our website for a couple years now, but we are always trying to disseminate them because we do think they're awesome tools. And when Tammy sends out the PowerPoint afterward, you'll be able to access these tools. Both of these documents are hyperlinked here. So the first one is our Healthcare Transition Readiness Assessment for students with an IEP. And the second tool is Healthcare Transition Sample Goals, which is a cheat sheet item that we have made for special educators to develop transition plan goals. And now I'll walk you through each of these tools. Next slide, please. So here is that Healthcare Transition Readiness Assessment. I know that the image is a bit small, but again, after this presentation, you can definitely check it out on our website. So at the top, you'll see we have some directions, and then the first section of this readiness assessment is a personal care and use of communication supports checklist. And the next section after that is a scale from 0 to 10, transition importance and confidence. So here we like to ask the student and the family, how important is it to you to move to a doctor who cares for adults by age 22? And the second question is, how confident do they feel about their ability to move to this doctor who cares for adults by age 22? The next section underneath that goes over a list of health care skills. So this includes things like, I know to ask the doctor office for accommodations if needed. I know the names of my doctor. And the section beneath that is on medicines. And so the questions include things like, I know the names of the medications I take. I know what to do when I run out of my medicines. And for both of these sections, the idea is that a student or a student who's filling it out with the help of their family can mark, yes, I want to learn, or no for each of these skills. And this one-page readiness assessment is best paired with, Tammy, could you go to the next slide, please? Is best paired with this sample goals cheat sheet that the IEP team can use to develop goals for the IEP transition plan. So on the left side of the sheet, you'll see the section that says My Health, and that corresponds with the My Health section of that readiness assessment. And on the right side, we've developed sample goals for each of those health items. So next slide, please. So the back of the sheet goes through the My Medicine sections from that health readiness assessment, and the right side of this sheet has the sample goals for each of these. And for all of these sample goals, they are a bit open-ended, so you can fill in and edit as you see fit, but they correspond nicely with that readiness assessment. Next slide, please. So here I'm going to walk through a example of utilizing this readiness assessment. So if we can go to the next slide, we have the readiness assessment section on My Health depicted here. And we have an example where a student has marked no on the item that says, I know, or I can find my doctor's phone number. And if you go to the next slide, we have the example goal setting cheat sheet. And if you go next, you can identify that item from the readiness assessment, and you can line it up with the sample goal. So here is a sample goal. By the end of the IEP cycle, the student will name and identify their doctor in their phone when asked with blank % accuracy. And if you go to the next slide, we offer some ideas about how to achieve this goal. So here we list that you can work with your youth or young adult to add their doctor's name and phone number into their phone contacts. They can also access Got Transition's medical ID resource and follow the steps to add their health and medical information, including their doctor's phone number, into their phone app. This is a great resource if you haven't seen it before. It's linked here, and it walks you through the steps of utilizing the health apps that are on your phone, your smartphone, for an iPhone or for an Android phone, so that emergency information is always at the ready. And then practicing these skills just to get used to being able to achieve this goal with practice. So yeah, both of those tools are available on our website, and we will also soon be adding the healthcare transition checklist with PTC to our website as well. So all of those working together will be a very nice set of tools to use for your youth and young adults. And I'll
Wonderful. I'm going to turn back on my camera now because we wanted to have a little bit of time. You've heard a little bit from us about sharing what these new tools are quickly that we have out for you guys and for families. But we want to hear some things from you as we're working in this field, and you guys are in this field as well. So we'd love to know, looking at the question number one, what are some additional tools for students that would be helpful for transition, for transitioning to adult healthcare? So there's a couple ways you can let us know the answer to that question. So what tools would be helpful in this? What are you looking for? What have you seen that's important? You can put things in the chat box, or if you want to raise your hand, we can unmute you or turn on your camera as well. So just let us know what you see. Great. I hope, and everyone can see, well, sometimes so someone has said how to navigate finding a provider within your network. Absolutely. I know for my own personal family, that has been quite a task to find a provider that, one, takes the insurance that we have, but also two, understands. I have an adult son with a disability and understands really how to work with him as he's mostly nonverbal. So good. I see a couple of people have raised their hand as well. Well, let me get to that and see. Forgive me.
I see a couple questions
yes,
about.
Please go ahead.
Yes, a couple questions about apps. The Administration on Community Living recently awarded a 5-year grant to Family Voices, and with Got Transition and SPAN as well, to create a National Resource Center on healthcare transition for youth and young adults with developmental disabilities. And as part of that grant, there will be an app that is developed for use around healthcare transition. So I just wanted to share that.
Wonderful. Yep, there's lots of good stuff coming in here. I'll let you guys, point those things out as you, because it's hard for me to follow that as well. But I'm going to, Lisa has raised her hand. So Lisa, I'm going to click allow to talk, and that will enable you to answer this question. You'll just have to unmute yourself. Lisa, if you're able to unmute yourself, then you would be able to ask your question.
Do you want to, Tammy? Do you
she
want to
says
just
error, so she's having some difficulty. Lisa, if you can put it in the chat box, then, and we'll take care of that.
I see someone asked a question if we could print out these, create an email with the questions and put in answers where we have answers. I think that's a great suggestion. I also saw a question that came up about navigating health insurance.
Yes.
I think we have been, Samantha and I have been doing work in the Baltimore School Mental Health Project. And with that group, we have put together some resources about what we're calling a discharge wellness, not a discharge, a wellness. Samantha, help me with a wellness plan for the seniors that are graduating.
Yeah,
and,
it's a post-graduation wellness plan.
Great, sorry about that. And one of the pieces that the therapists wanted help with was around health insurance. And so what we have suggested is taking a picture of your health insurance card on the front and the back of it and kind of reviewing that with the student. And we also put together a very simple set of questions and answers on health insurance, and again ran it by some Maryland advocates who are working on health insurance as a way to get some site-specific resources.
I also see a question from Nicole Burning. You asked about infographics with 2 to 3 strategies for medical professionals to help support students with autism and other medical conditions during their medical appointments. I'm going to direct you to a GOT transition resource that was created in order to give clinicians some guidelines on integrating young adults with autism into their practice. So I'm just going to drop that into the chat.
The trivia idea sounds like a great one.
That's
And
great.
if anyone wants to share that, their trivia questions, that would be fun.
So what we will do is gather these, as Peggy said, we'll gather these, the chat box information and put out, I don't think it'll be today, but we'll put out to everyone who has attended, we'll put out some information around the questions and share these wonderful ideas that people are having here.
And Tammy, can you say a little bit more about your life skills checklist, like the various topics that you cover and how it's been used?
I can. You know, we found that for a lot of students, that was one of the biggest issues that they, in the biggest places they needed support was around, you know, this life skills checklist, really looking at independent living skills. And so we took the skills, did a lot of research with families and students themselves, and trying to find what are those areas that there may be difficulties in, or maybe strengths in. I mean, sometimes, you know, vice versa. So, so we talk about things from, you know, personal care, sexual health skills, as well as, you know, skills within the home, skills in the community, transportation, you know, and all the way from dressing to, you know, taking care of hygiene issues, and then really try to break those down into individual skills that would need to be there. And again, with those same options for people to assess where they're at, those same that you saw on the healthcare transition checklist, to really, again, to be used as a multitude of ways, but to be used in planning, assessing, goal setting. And we really are encouraging families to start early so that you have an idea of, you know, okay, in this area, you know, there's some things that we didn't really think about, like being able to get up on time, how important that is if the child's going to have a job, live on their own, or go to college. I know some individuals who super intelligent, just really great at their academic side of things, and going to a 4-year college, not needing a lot of academic support, and yet they struggled, and a couple of them ended up having to leave college because they didn't know how to get out of bed on time, or to have a schedule of when to check emails. One young man said, well, you know, I check emails about once a month. Well, that's not going to work if your professors are emailing you assignments and things like that. So I'm really looking at those skills that can be individualized for a student, to see what are their plans for the future and what skills need to be put in place. And I think, oh, go ahead.
Tammy, there was a question that just came in about someone whose child has autism, and they commented that they know how to do them, but they need to be reminded. And again, I want to highlight the importance of Tammy's topics that you have used. It's not a yes, no, or not applicable. You've given You can say, can do it already, need more practice, plan to start, or ongoing support needed. And
Exactly.
again, I think that's really nice what you laid out there.
Right. For some individuals, there's going to be a skill, for example, that no matter what goal you put into place, they're going to need support to do that. And then there are other times where a skill may not be applicable in that person's life. It is not, for example, for me, knowing how to, or let's say I don't have a job. So the skills that might be in a job site, I may not need to be working on those skills. Or my body physically, let's say my hands will not allow me to grasp a razor. So working on shaving in a traditional way is probably not a skill I need, I'm going to need support. However, that's a way, sometimes you just have to look at those things and decide, what's appropriate. We don't want to just say, as Peggy said, yes or no, because it's not a yes or no world in these situations. There are some additional pieces to take in and keep in mind. And also, you see, I know we've talked about that transition to adult healthcare. We've also kind of ran in the realm of the second question here, which is those life skills. So I feel like we've kind of hit, both of us. So feel free to answer that second question as well if you were waiting, for that second question, which is more around the life skills pieces. Any additional questions that might be out there?
Does Bridget have her hand raised?
Let me see. Sorry, I'm trying to navigate that chat box too. So if you're also allowed, if you can find her in the chat box. Right. I'm not seeing any raised hands when I scroll through the chat box, and I'm not sure why. So
I have Bridget. So Bridget, I'm going to allow you to talk. And I think you just have to unmute yourself.
Hi.
Hi, Bridget.
Okay. Hi. How are you? Bridget Davis from Parent to Parent of Georgia. So I know that we have the adult to healthcare transition, and how is that incorporated with like regular transition planning from high school? If that makes sense, is there any core, is there a way to address healthcare transition in the transition plan for these students that may be leaving high school?
I'll start and I'll turn it over to, okay. I'll turn it over to Got Transition as well. Absolutely. I mean, we firmly believe at PTC, and that all of these things, the IEP and the IPE for employment and this healthcare transition, all need to tie together, and the goals need to be all working toward, the same end in mind, as we like to use. We've actually just been working on a document with RAISE, and it should be coming out soon. It's a chart that talks about those three specific areas, including healthcare plans as well, and how those things can mold together in the planning of for this transition plan, because they should not be operating in silos, because it's all about this one student, and so you're going to have to work together. That's why there's those agency connections in the IEP meeting, bringing everyone together to talk about what is this present level, whether it's healthcare, whether it's employment-based, whether it's independent living skills or academics. What is the present level of this student, and what are their goals for after high school? And so what things need to be worked on. So absolutely they can be. It takes some work. It takes some work of people to work together. And sometimes it takes someone kind of overseeing the case management of, hey, everybody, we all need to get around this table to talk about this and work together so that they're not siloed with different goals. You guys Got Transition. You guys have anything to add to that? Sorry.
Yeah, I want to just say that, under the federal law, health is not required under transition planning. So again, when we've been doing our work in the District of Columbia, we were imagining the potential of adding into our state administrative rules health as a separate part of transition planning. But it appeared that there was much more receptivity of incorporating health into independent living. And so, again, that's an advocacy effort because currently it's not required, but at least from our experience, and I'd love to hear Samitha comment, there was a great deal of receptivity.
Yeah, we presented this idea to DC's community of practice on secondary transition. They were very much behind this effort, and it's a mix of parents and special educators who make up that group. And within that effort, we found so many parents to be excited about this idea, either having healthcare transition as part of independent living or as a separate domain, in addition to the other domains. However, I think a lot of these schools and special educators were saying, you know, it would be more feasible if healthcare transition was part of independent living. But yes, it's a advocacy effort that's much needed, and we are always trying to bring a focus to that in different ways.
Nicholas, I know you've been trying to speak. I'm going to try right now to allow you to talk, and that let's see if that will work.
Thank you.
You're welcome.
So, my name's Nicholas Workey.
Okay, did you have a question?
No, I just wanted to make myself known.
Okay, well, thank you. We're glad you're here, Nicholas.
My name's Nicholas. So,
All right, wonderful.
I just
All right. Well, if you have any other questions, you feel free to put those in the chat box. Okay, we're glad you're here. I see a couple of, you're welcome. I see a couple of questions here about getting information out in various ways. You know, I know I can speak for Pizzi and ask about how are we sharing this with local ed departments. We do work with, with local education department in Virginia and families there, but we also on the RSA grant regionally work with other PTIs and transition related partners who then work with their local departments of ed. That's a difficult thing. Sometimes there's lots of turnover right now, especially the last couple of years everywhere, and getting it in the hands of the right people. But we continue to do that. But if you have, always feel free, if you or someone even, you want to recommend to someone to join our email list, we send out, and our social media is very active with new resources and things. So feel free to recommend that. Got transition. Do you guys want to talk about how you outreach your information out to the departments of ed and things?
Yeah, one of the ways we did this in DC was we brought our readiness assessment tools to the attention of the Office of the State Superintendent of Education, and they incorporated those tools into their annual toolkit that they come out with, which serves as a guide for special educators. So it is embedded there, and I believe it's an electronic document as well. So it is housed permanently on some sites. So we did send it and work toward that goal.
And Samitha, could you mention also where our school resources are on the Got Transition website?
Yes, I can. So if at any point someone wants to find all of our tools, we have grouped them together on our website. If you go to gottransition.org, at the top, one of the headers says special populations. You're just going to click on special populations and you're going to scroll down. You'll have to pass foster care, intellectual and developmental disability, medical complexity, keep going down. School health is a big piece of that. And I can share my screen so you can see. Actually, I'll start from the home page so you can properly see how to navigate this.
Sorry, the homepage of what?
gottransition.org.
Oh, great. And school health, you said?
Yes, so if you can see my screen right now, this is the homepage of Got Transition. At the top, we have all of these headers, and you're going to want to click on resources and research, and it'll drop down to special populations. So just hover over resources and research, click special populations, and you'll see a large grouping of some really awesome resources. And if you go all the way to the bottom, you'll see school health. And we have sections for special education, school-based health center tools, and school-based mental health tools. So
Thank
the
you.
ones, yes.
Thank you.
Oh, you're welcome, Nicholas. The ones that we discussed today are under this special education section. So
And
yeah.
we'll be excited to add the PEATC new tool to this as well.
Yes.
I saw one more question very quickly, and someone was asking about using things, got transition documents or PT documents. Do we need to request permission? I can only speak for PT. First of all, and sharing on social media, you are welcome to share on social media anytime, any of our documents and things. That is not a problem. And you feel free to use the links and share those within something that you're doing for your state. At PT, we are fine with you using it as long as it, continues to have our logo and things of that nature. If it's something you're going to sell, then we would like you to contact us and let us know that. But if you're using it, just for us to know you're using it is great. We're glad to help. So, but Peggy, I don't know what you guys stances.
I think we have a sort of similar policy, Tammy, that, we love to have our tools shared widely. And we also always encourage people to customize our tools based on what their population needs are. But if they're like using exactly our tools, if they could have some attribution to where they obtained them, that would be what we prefer. And again, we're not in the business of selling these things, so that would not be what we want to see happen. But we love the sharing.
Yeah, and feel free to always, if you share on social media, you can always tag us. We might even reshare. And then if you want an example of our Got Transitions attribution statement, you can always find that in our FAQs.
Wonderful.
And Smitha, could you just say a couple words about the short video? You posted it in the chat, but just so that people know, because so often people want just a short, brief video.
Yeah, sure. So I posted a link to a healthcare transition 101 video that we recently released on our website. It's actually on the homepage of our website, so you don't even need to click around too much. And the theme of the website or the video is, what is healthcare transition and what does it mean for you? And it's not long at all, I believe. It's just to see the time, it's about 1 minute. So it gives a quick rundown of what healthcare transition is. It's cartoon based, so it's quite fun to watch, and it is soon to be available in Spanish. Right now it's just in English, but we will definitely have the Spanish one available once it's on our site.